You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Cristina, how are you?
Very good. How are you?
Thanks for coming over.
Good. Well, thank you for inviting me.
Why do we need to change healthcare?
Why do we need to change healthcare? That is quite a loaded question. I'm going to say we need to change healthcare because the world is changing. It's constantly evolving. So I come from the administrative space, so it's trying to constantly be on top of what these changes are, but also being equipped to help my team throughout these challenges. So whether it's my clinicians that I'm working with or my administrative team, is just really focusing on what's best for our patients.
Yeah, I wouldn't have asked this question if something has to change. Like something needs to change in healthcare. And I'm trying to figure out with people like yourself, with a lot of experience in this field, what can we do to make it a little better for the medical staff and for the medical physicians. And I'm not talking about the patient care. I'm talking about how is healthcare keeping up with the demands of the medical staff, because people get older, they want to retire, they don't want to work that much. The shifts are not that long anymore of work, and I'm trying to figure out what can someone like you do to help us get over this unbelievably hard way of practicing right now.
That's a great question. And I feel when it comes from the administrative space, it's understanding that clinicians are human. And we tend to look at, like, you're looking at things and it's understood. Like, clearly, clinicians, those that are in the medical field, went in for patient care. You want to do what's best for the patient. And the way things have changed over time, healthcare is a business. So it's that crossroads where trying to find the happy medium between, the expectation of, in order for hospitals or for health centers to survive, you've got to focus on the volume, the number of patients that are coming through. There's KPI. You're looking at it from that. To me, it seems like a very, what's the word? To me, it just seems very cold. Right? Like, you're just looking at it from numbers, but not realizing to hit that target, that is human power. That's people behind it. And you're seeing, especially with COVID, we've seen so many healthcare workers leave the healthcare space because of the fact that there were so many demands. There was the fear that led into it, and everyone was scrambling. But it was always that focus of you just keep pushing, and placing those demands on clinicians. So it's obvious you're going to see that burnout. So it's, for me, it's trying to find that happy medium between, just having that understanding from that administrative space is, if you want to see, if you really want to see those numbers, if you really want to see producing, right? Like, if you really want to meet that end, you have to really address the human factor that's involved in it. And it's a challenge that many people face. And especially for me right now, working in the rural space, it's a complete eye opener, having come from New York. So it's definitely a shift.
Yeah, it's basically a shock to come from that kind of system, a big city system to a rural environment. But you said something earlier that kind of, I'm having some flashback from COVID time, and I can't stress enough the fact that when that whole pandemic finished and kind of came to a normal level, every single specialty in medicine was facing a shortage of providers. And I'm not sure what happened in the mindset of a practicing physician after that pandemic. But I can tell you that in my field and in several other fields, I see people not wanting to practice anymore, for reasons that I don't know what clicked in their head with that pandemic or what happened, but they have difficulty coming back to work after that. And most, a lot of people retired, a lot of people just gave up medicine, a lot of people just refocused on family or some other things. And I don't know how we're coming out of that. Like when 2025 right now, and we're 3 years after the pandemic ended, and I'm trying to figure out where we are. Where do you think we're going to go from here?
There's so much trauma tied to it. And I feel that's something that so many need to address, is that underlying trauma, because the only way we're going to move forward is by addressing that. Like I still know many who still practice, who worked on the hospital floors, who in inner cities, who witnessed all of this, like like what it did to them, and they're still practicing. But from their aspect, it's like, I do it because this is what I'm passionate about. But I wish that there could be greater resources out there. I wish they could understand that we're human, and I think we're at that point right now where it really is that crossroads for people, where from an administrative space, I admit it all the time. There was that period where I was like, do I still want to stay in healthcare? I've been in it for over 20 years. What can I do? And then, through my experience and through education, just started realizing, okay, maybe your space and your experience now as a leader is to really help teams start to work through that trauma, start to understand them, start to listen to what those concerns are, and start to work together to help resolve it. Because I can't resolve the issues of what clinicians are going through. I need to work with them. I need them to feel safe enough to come to me to tell me what the concerns are, and then my team can work together to help make this a bit easier and more supportive.
So tell us a little bit about your journey. How did you start in this thing? What made you choose healthcare? Why are you doing what you're doing now?
I fell into it, right? Like in college, I started working for a family practice as a receptionist. Throughout college, then I landed working. Originally, I thought I was going to be a writer. Like I'm a musician. I thought that's what the life I was going to be living, like, just traveling on the road, writing, doing all this good stuff. But I came back to healthcare and worked my way through the ranks. But really where I found my passion was with quality, patient safety. But through that process, really started, especially in the FQHC space, enjoyed working with teams. And I did a little bit for about 3 years working for a consulting firm just to broaden my horizons. And I really appreciated that opportunity because it enabled me to see different aspects, like those organizations that had all of the resources because they were like part of a hospital system versus those that were truly like, I worked with a health center that serviced the Shinnecock Indian tribe in Southampton, New York, which was such an incredible experience. So you saw all different aspects. And what I truly enjoyed was not only focusing on like realizing I had the skill from the quality perspective, but the relationship aspect, and starting to understand and have that ability to kind of see through, this is the challenge, but start to uncouple the, like what is the root cause of this? And that's when my journey began.
Very nice, very nice. What are you now presently? What are you doing? How can you go from here?
Currently, I work as a chief operating officer for an FQHC based in Maine. So
tell us what does that mean? FQHC,
a federally qualified health center.
Okay.
I always forget. Not everybody.
Yeah, exactly.
Not everybody knows. I should know by now. But nice. A federally qualified health center in Maine, and it's such a great experience because what I truly enjoy about working in the FQHC space is, especially in the administrative side of it, is the ability to see that change. Like when you work in hospital system, when you work in larger organizations, it's very hard to see that movement. There's a lot of red tape to go through where my organization is very flat. And I just love like the way I lead is I'm on the floor. Like I am walking around, I'm checking in on my teams. I'm just pitching in wherever I need to pitch in because it really lends perspective to what's going on from the leadership level. So when there's concerns that present, or how do we face this challenges, at least you're sitting in that seat and you could truly understand what those challenges are. And in the end, that ability to work with patients or to see your team and like at the end goal with all of the efforts that they put forth to help a patient. So it's a great experience.
Very interesting. What do you think is different in practicing in a setting like that? Federally qualifying, facility in a in a rural environment compared to city setting or a very busy trauma center or anything like that?
You have to be nimble. You have to be creative. You have to be innovative. That's really what it comes down to. And you really need to start focusing on what's around you, building those relationships with community organizations, seeing what other facilities are doing, and really doing that boots to the ground partnership building, which I really find exciting because it's great to just, it helps you realize that you're not alone in the space, that there are others that are facing the challenges. And there's just something beautiful about other organizations and other groups coming together to really, help the greater good. Because a complete eye opener for me is realizing we think there's a shortage, but where I'm at is realizing that, okay, to get in to see a dermatologist, you're going to be traveling at least an hour. If you want to see a rheumatologist, there are people that are going out of state to New Hampshire. They are waiting at least a year. Some of these facilities are really kind of honing in on like, these are the conditions that we will see. So we suggest maybe you start here. So it's easy to understand how people could lose faith in the healthcare system. And then thinking that other piece of it is those patients that face challenges, those with transportation issues, financial issues, our elderly population, like how are they getting the care that they need? So really thinking of ways on how to meet these needs.
Yeah, it's a completely new set of challenges where you are right
Yes.
now. And I'm thinking, it's one of those things that people don't realize, that the majority of the United States territory is rural. And it's big, and it's bigger than we think it is. And like you said, the distances are so hard to accomplish, for a patient that has issues with, transportation or, like you said, challenges of this nature. And it's not about shortage of obviously shortage of providers, but it's how do you set up those point of care, right? Everywhere that you should have one. Like in a small city, in a small town, what can you have? Do you have an urgent care? Do you have a specialist? Do you have a primary care? What is appropriate to have in such a setting?
I think right now I could say from where I'm situated, or like where my facility is situated, or my sites, is at least there's a bit of proximity. Like it's not so rural, right? Like you might be about 10 minutes, 20 minutes outside of like the major towns. So you do have urgent cares, right? But you have the urgent cares there. You've seen a lot of facilities, like let's say if it's home care, that's really not existing much anymore. I mean, I do have some providers that do offer in-home services, but you really see these limitations where back in a larger city, you just step outside, you walk every few blocks, there's an urgent care center, there's there's a medical center, there is something always around you. So in order to get to I just saw it recently with a patient who was trying to get in for like something that we take for granted, like a basic screening, that took months for them to get into. So it really is an eye-opener there, where you have to start thinking about like, okay, is there the ability to offer like mobile units? How can we do that? Is there the ability to, like what we've started doing is virtual, like partnering with some facilities to do virtual care. So if we have a patient, say it's like something that's suspicious, like a mole, instead of waiting a year to be seen by a dermatologist, let's do something that's virtual, so we could at least triage, okay, is this something that could potentially be malignant? It looks a little suspicious. Maybe this is something that we can make more urgent versus something else, and we can figure out the route that we have to take.
Yeah. Cristina, let's go back a little bit on yourself and your personal approach to what you're doing. And I'm sure you came to a stage in your life that you have enough experience, enough knowledge and wisdom to look back. What do you think are the habits and the routines and the patterns, I would say, that you think you have to get you to this point?
Persistence. Like I never saw a setback as a setback. It's just that ability to, like, I never let it knock me down. It was, okay, what was the lesson? in that. What could I do differently? It's just accepting it with grace, but also in a good way, being stubborn. Like I've balanced it out as I've gotten older, but always set the bar high for myself. And always like to take on a challenge. And I feel too like a really thankful for the fact that I've had opportunities where I had the ability to navigate different sides of healthcare, especially when I worked for a consulting firm where, although my work was geared towards like more quality driven aspects, I had the ability to kind of dive in and understand more of like a coding and compliance side of it. So you see how it ties in like all together. But I feel really being open-minded was helpful, and just keeping that mindset that, you don't know everything. Even though I've been in this industry working in administration for about 25 years, there's always something to learn.
Yeah. You said something earlier about the way you're persistent, and you took things and you transformed them basically in a success. But we generally don't learn from success. We learn from failures.
Failure, yes.
Can you give us an example of something that went bad into your life and it didn't work out, and you learn from it and you move forward and you become that persistent human being that you are right now?
That's a deep question. I could say definitely something that sticks out is, I had an opportunity, and I worked with, I worked in an organization for a little bit, and it was not the most positive of experiences, I'll just say. But in it, like, I had to do what was best for myself. And it was one of those moments of, you have to step back, even though, like, without that safety net, just trust the universe that things will happen. And mind you, it was like, here I am, I'm in this state, it's something completely new. So you start thinking like, oh, I wish I didn't make this change. I wish I didn't do this. But yes, there was like that month or so when you're just panicking. But in that, there was the ability to, partner and explore with a consulting firm and tap into a side that I never really thought about tapping into, like facilitation and working on developing education, right? Like to start presenting. And it really tied into my passion for workforce well-being. So I just started to kind of take that step back and see, like, what's the lesson learned here, right? Like, don't get so stuck in the suck, right? Like, it's just really just kind of see what this positive piece is and build on it. And, what I learned in the process was I started to own my voice. I started to develop more confidence. And, like I never saw, to be completely frank, like never saw myself in executive leadership. Like I was completely fine and there was nothing wrong. Like I always say that to people, like, you're comfortable, you're comfortable. But for me, it just felt like a fear making that jump that I wasn't qualified to do it when I knew I did. So I just feel like that whole experience where I completely felt depleted, like, literally, I'm not worthy. I'm not smart enough to do this job. Like clearly, like all of the bad things. But flip that script to use that as empowerment to move forward, and had the ability to land where I am right now. And I'm so thankful for that, because it's a great organization that I'm working with, and I love my team. And it's just continuing to flourish because of them and because of the experience.
That's an awesome example. Would you have changed anything if you look back into those years?
No.
What kind of advice would you give to yourself from the point that you are now when you look back then?
That I'm very sorry. The advice that I would give to, like, looking back
to yourself, yeah.
That I would I would say that, you know what, like you doubted yourself far too long, but there's always a reason why you follow a path. Like, it's like there's always, I'm like, you throw yourself into the fire. I've thrown myself into like experiences, because that's the other piece that I'm really passionate about, is I want to step into the space of educating and speaking. And without this experience, it's like, without that, you never would have gotten to the point you're at now. So it's okay. Like, trust the process. Really, that's what it comes down to.
Yeah, that's very interesting how life works, right? Because sometimes you need those experiences, negative experience and failures, to put you in a situation where you're more capable of understanding what comes next into your life and look forward to that place. And like you said, you doubt yourself for a little while, and then you regroup and you grow, because there's no way back.
Exactly.
And I love the way you said that. You doubted yourself, and then you kind of stepped into the fire, because it's interesting how successful people get to a point where the only way to be successful is not look back and just look forward. Where are you going from now? What's the next step?
The next step. Right now, what I'm doing is, I took a bit of a step back. I'm in a doctoral program for leadership psychology, and I took a step back because there was just too much going on between trying to focus on school, like a full-time job. It's like I'm a caretaker. I've got all these things that are going on. And I was like, you know what? You need to take time to nurture yourself. But through that nurture, it's not like, okay, you're taking a step back and it's just, all roses and daisies and you're skipping in a field. For me, it was start to explore, like, just really throw your hat in the ring for like conferences that are coming up that really kind of set your soul on fire. Like, yes, this would be a great idea. Like when I started exploring and seeing some conferences that were coming up, I just had so much fun just creating proposals to send out there. Really educating on my experience, because I feel, yes, everyone needs to go through life. You need to experience those moments when you're getting knocked down, and build yourself back up. But sometimes I feel like, man, I wish I had somebody that could kind of be that, that big brother, big sister in a way, that could say like, hey, I've been there. It's going to be okay. And that's what I hope to do, is to be that big sister to somebody through my speaking, through my writing, that, it's like, you're not alone. You'll be good. You'll be okay.
That's so cool. Leadership psychology. And I'm thinking, do you think leaders are born?
That leaders
are born or thought?
Oh, that's a good one. I feel it's like we have so much of this thought that, not, like, I can't be a leader. There's that piece within you. And what I've started learning through my program, it was almost like it was such an eye opener, like my first semester, because it really had you start to deconstruct what you've been so conditioned to think as far as what leadership is. Like, you have those leaders that are calling the shots. It's not listening to everybody else. It's just like, this is it. In order to be a leader, you have to be loud. You have to have that presence, where we see like that true leadership, where you get that buy-in, where you really get that job done, when you really build that trust, not necessarily comes in that package.
Yeah. There are several examples like that. Mm-hmm. In the business world. I don't know about in healthcare, but in the business world, they, you have on one side you have a Steve Jobs type of leader, loud and decisive, and doesn't care about what everybody else is saying or doing. He's 100 years up, ahead of everybody in thinking. Mm-hmm. And then you have someone quiet and respectful and persistent, and someone who does the job well, like Tim Cook. I'm talking about Apple here, who, you don't hear much about him, but he's doing the job every single year after Steve Jobs died, and he's an amazing leader. What do you think is going to happen with the leadership in healthcare? Because my question is more geared towards, are we better off having leaders from the medical staff, or are we better off having leaders in healthcare outside of practicing medicine? What do you think?
I think there needs to be a balance. There needs to be a balance, because I don't feel it's fair to be pushing these expectations downward towards my clinicians without having a true understanding of of what goes on in their world. And I feel like when you see that healthy balance between like clinicians that are in the leadership space, they're able to lend, like they bring that lens forward as far as like, this is how it impacts the clinician, which I feel is so vital. Because we're like, a lot of times what you're seeing like in healthcare is you might be seeing a lot of people with that business mindset where, you know, they're looking at the financials, they're looking at all of this. So again, it's like these are the KPIs. Like, I don't care about how you have to do it, just do it. And that's where, you know, I've been in situations like that where it's like you're not going to get that buy-in because you're just looking at somebody like they're a machine. And it's so easy to see how they're going to get burned out when you're not putting into context just how complex the cases may be that are on their schedule, right? Like I might have a clinician who is seeing 10 patients a day, but those patients could be so intensive versus somebody else, right? So it's such a, like I personally feel like there needs to be that balance within leadership, without a doubt.
I see. How can people reach out to you, know more about what you're doing, and maybe see you on that stage at some point?
Thank you. You could find me on LinkedIn, Cristina, Cristina, Negron Oliveri, and that's where you could find me. And also my sidearm, which I do like a lot of my speaking engagements and my education and all of my writing, that's ChangeWorks Consulting, which also has a page on LinkedIn.
Does change works?
Change works. Yeah, change does. And I always tell my team, you know, when they see me and I'm like, are you feeling a little uncomfortable? Yes. All right. Like we're good. You see the little spark in their eyes. They might be like, oh God, no. But yeah. They're in it. It's a great group. But,
yeah. I mean, listen, that's what progress means, right? It's the thing that we do when we're uncomfortable. And we find solutions and we find ways of getting out of that uncomfortable feeling. But once you get, again, into your comfort zone, nothing happens. You stay there. You're very well, in that situation.
Yes. And I live it every day. I throw myself into that seat of discomfort.
Yeah, exactly. Cristina, thank you so much for being here. I hope people had a different perspective from your side. And, it's important for clinicians to listen to the non-clinical part of healthcare, because I think you guys have a different optics towards what we're doing and how healthcare goes in general. So thank you.
Thank you so much. And yes, different perspectives. That's a lot of times where you see that magic happen. So thank you, Dr. Franco. It was such a pleasure and I appreciate your mission. Thank you so much.
Absolutely. Take care.
Take care.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.